everyone. Thank you for joining us today for our ALS Webinar Wednesday series. My name is Kelly Hall. I'm a marketing coordinator for ALS North America, and I'll be facilitating this webinar today. Before we begin the presentation, I have a few helpful notes. If you are having any technical issues with our webinar platform or any questions, feel free to type your message or question in the chat pod, which is located at the bottom right. You can also select the hand icon to notify me of your status so I can assist you. All questions regarding the webinar material will be answered at the end of the presentation. Our presenter today is Dr. Rania Ibrahim. Dr. Ibrahim holds a doctorate degree in pharmaceutical sciences and a master's in biomedical engineering from the University of Cincinnati. And since 2011, she has been working in the field of safety and clinical testing for cosmetics, personal care products, and OTCs. Currently, Dr. Ibrahim is the clinical director at our ALS Bioscreen Laboratory in Phoenix, Arizona. Rania, thank you so much for taking your time to deliver this presentation today. I will go ahead and turn it over to you.
Thanks, Kelly. I appreciate it. Thanks to everyone who is joining the webinar. Today, I'm going to talk about clinical testing overall for the cosmetics, personal care, and OTC products. And I'm going to focus on some safety testing, talk through that, and some efficacy testing. And definitely at the end of the talk, feel free to ask me any questions, or after the talk. I know how it is sometimes you go away and you come back and you're like, oh, I wish I had asked that. So I'm going to start off with talking about just basic safety testing. So there are a number of safety tests that we perform for cosmetics, personal care products, and OTCs. The most basic safety test would be the RIPT, which is the human repeat insult patch test. Here in the United States, we do a minimum of 50 subjects, and the RIPT is essentially a safety test that will give you information on two things. You will learn about the irritation potential of the product, and you'll also learn about the sensitization and allergic reaction potential of the product. It's a 6-week test. The initial phase of the test really focuses on that irritation potential, which is what happens after repeated application of the product. Obviously, it's a super exaggerated test because you take the product, you place it under a patch, and the reality of the matter is we don't really put products on and wrap ourselves in saran wrap. While with COVID, that may not be a bad idea. But yeah, so it's super exaggerated. And then after those 3 weeks, the subjects go through what we call a rest phase. And in that rest phase, it's about 2 weeks. And what happens is, because of the multiple applications of the test product, if someone is allergic to something that they've been exposed to, then what happens during that 2-week phase is that the body starts building this immune response, where basically the body is saying during this phase is, if you apply this product to my body again, a reaction is going to show up and there's going to be this immune response. And that's what we see in the final phase, which is the week 6. And, you know, if you've seen our RIPT reports, we call them the challenge phase. And normally, if we see reactions, even one reaction in that phase, final phase, we will flag the product, because sensitization is a pretty big deal. And there are tests that you can do to confirm whether the reaction was observed was a true positive or whether it was just, you know, somewhat of a fluke. So that's essentially the RIPT. The next safety test is the cumulative irritation test. There are 2 options for those. You can either do a 14-day or a 21-day. Lots of literature and studies have really shown that the 14-day is really enough to show you and give you the data to indicate the irritation potential. So the 21-day is really just kind of going overboard. So most people will choose the 14-day. And this test is really helpful in, it doesn't give you information on the sensitization potential, but it really is, it's an extremely aggressive test in the sense that they're literally wearing the product under a patch for 14 days straight. So there's no rest. Like in the RIPT, they wear it for 24 hours, the patch comes off, so their skin's allowed to breathe, whereas with the cumulative irritation, that isn't the case. And this is a really good test to decipher irritation potential between products. So let's say, for example, you have a product that maybe was a little irritating. You got some consumers complaining about the irritation potential. Then you reformulated, and you really reformulated, and the idea behind the reformulation is that you've developed this product that's less irritating. So the cumulative irritation test is a really good way to vet out the differences in irritation between one product and another. And then there are some organizations that require it, like if you're trying to apply for the National Eczema Seal, you have to perform this test. So that would be the cumulative irritation. And then there are the safety and use studies, which are a true use test. So as I mentioned, the RIPT and the cumulative irritation is a really exaggerated test. Taking the product, you're placing it under a patch, and that really isn't how we use the products. So if you're really trying to understand how the product reacts to the skin under normal use conditions, the safety and use would be the best way to do that. And there are some products that are probably also really irritating. And so they just really can't, they're not appropriate for RIPT or cumulative irritation testing. So the safety and use would definitely be the way to go. There are a variety of things that you can look at in safety and use tests. You can, if you're trying to make safe or sensitive skin claims, you can recruit a number of subjects who either identify as having sensitive skin, or they can actually be tested using a lactic acid test, which is you basically take lactic acid and you swab it at the nasolabial fold, and you compare that to water. And if they sting to the lactic acid but not the water, then they are considered to be sensitive skin. Which method is preferred over the other is really debatable. A lot of people believe that most people know their skin. I mean, I know my skin. I know that I'm super sensitive, and so a lot of people will kind of just go with that self-perceived sensitive skin for these types of studies. And then there are a couple of others, the phototox and photoallergy, to determine if the product is phototoxic or is causing allergic reactions due to exposure to UV. So those are the dermal safety type of testing. The other type of safety testing that is performed is ocular testing. So if you are making claims that the product is safe to use around the eye, then you would perform an ophthalmological safety test where the product is used around the eye, and then subjects undergo an eye exam before and after use of the product. And with these kind of tests, you can also make claims that it's safe for contact lens wearers or people who identify as having sensitive eyes. And then there's also some in vitro tests that really look at like ocular irritation, where it's more geared to what happens if the product actually physically goes inside the eye. And then finally, for ocular safety testing, there is the no tears claim. So for baby products that say that if it goes into the eye, it's not going to sting the eye, there is a test where you take the product, super diluted, you instill it in the eye, and the subjects have to grade the level of discomfort. And that's essentially how that particular test is done. It's required to do the in vitro prior to that, because if you fail the in vitro, then the chances of passing in vivo are slim to none. So that kind of covers the safety testing. I'm going to talk about efficacy testing, and mostly for skin testing. So a lot of claims, and we do a lot of these in Phoenix and California, are hydration claims. The reason we do a lot of them in Phoenix and Arizona is because we have a very dry climate. So we're not affected by high levels of humidity. Probably one of the great reasons I left Cincinnati. I have no bad hair days. But hydration claims is a superficial measurement of the stratum corneum. You're really looking at how much the product is hydrating the surface of the skin. And there are a variety of claims that you can make. It just really depends upon what you're going to say about the product. So if you're making all day claims, then you're probably testing 8 hours or 12-hour, you're taking 8 or 12-hour measurements. If you're making, you can make 24-hour claims. And then there are products which are really not appropriate for long-term hydration, like cleansers. Usually those type of products are tested at, really short intervals, like 5, 10, 15, or 30-minute. Same with shaving, if you're trying to say that your razor is hydrating the skin. And usually for these type of studies, especially the long-term ones, we sequester subjects, which basically means we keep them in the facility for the 8 or the 12 hours. They're in a controlled environment. We control what they eat, what they drink, because all of those factors can heavily impact the performance of the product. So that's hydration. The next claim, which is pretty popular claim, is the skin barrier function. So if you think of the skin as a Band-Aid, and the purpose of the skin is to prevent things from going into the body and from coming out of the body. And when you have an intact skin, what happens is that this Band-Aid effect, it creates this Band-Aid effect where you have less water escaping from the surface of the skin. And when you start compromising the skin, whether that's through abrasion or healthcare workers, for example, and we're even doing this today ourselves with COVID, like multiple washing of hands, so you're really abrading the skin, or products that have exfoliants in them. What happens is that when you start compromising the skin, you start creating these little tiny holes in the surface of the skin. And so what happens is that when you're compromising, you're seeing more water escape from the surface of the skin. So when we talk about skin barrier claims, we're either saying that the product is improving that Band-Aid effect, or in some circumstances, we intentionally compromise the skin by tape stripping or by applying SLS for a period of time. And then what we're doing is we're trying to show that the product repairs the skin quicker than what the skin naturally does itself. Because obviously our skin naturally repairs itself, but the question is, does the product do that quicker? And then also for these skin barrier claims, this is what you measure when you're trying to make claims like gentle as water, or that you have a gentle product. So if you have like a scrub and you're trying to say that it's not abrading the skin, this would be the appropriate test to measure that. We then have firmness and elasticity. So a lot of this is a big anti-aging claim, where what we're doing is we're measuring the firmness elasticity, and it's essentially the instrument is a probe that has this little hole, and in that little hole there's a vacuum. And when we place it on the surface of the skin and the vacuum turns on, we're essentially measuring how much force is required to pull the skin into that vacuum, which corresponds to how firm the skin is. And then once the vacuum is turned off and the skin releases, we're then measuring how quickly it bounces back to its original position. And sometimes, and I get this question a lot, is sometimes people will see like a really big improvement in firmness, but then the elasticity gets worse or vice versa. And this is an uncommon to see, and I always like to compare it to a mattress. So if you go with like a really firm mattress, you're essentially foregoing that bounciness or that suppleness, which is the elasticity. Or if you go with like a really bouncy mattress, then essentially you're foregoing that firmness in the mattress. So that's how I like to explain sometimes that discrepancy that you see. And sometimes you see both improve, but a lot of times you'll see one improve and perhaps the other doesn't. Exfoliation claims, we see a lot of those. So that's essentially what we're looking at is like flaky skin. So on the left is a DSCOM, which is essentially a circular adhesive strip. And what we do is we place it on the skin, it picks up these flakes, and then we run it through the instrument on the right, which is a SCOM scan. And it counts how many flakes were picked up from the surface of the skin. And then we apply the product. And if it is exfoliating, and if it is actually exfoliating, then what you would see is less flakes on the adhesive after product application. And this is a claim that we do quite frequently, and it often gets confused by my next slide, which is the cell turnover study. So those are like two very different things. Exfoliation is really just removing that flaky skin. It's a factor of that mechanical abrasion. Cell turnover is what the body naturally does. Just like snakes turn over their skin over a period of time, so do humans. And it happens probably approximately every 4 weeks. And so cell turnover claims, because the skin naturally turns over itself, there are products that their intention is to actually speed up this turnover of cells from like these old cells to more fresh, healthy cells. And the way that we measure that is we perform these on the forearms because we actually have to dye the arms with fluorescence. So danzyl chloride, I'm pretty sure no one would be excited about that being on their face. So we do this on the forearm. We have one arm, which is the untreated. So we don't apply anything to that arm for 4 weeks. And the other arm, we apply product. Subjects are applying product daily. And essentially what we're looking for is that the treated arm loses that fluorescence much quicker than the untreated. And that's how we determine if the test product is actually turning over the cells quicker than what the skin naturally does for itself. So these two claims of exfoliation, I often find people use interchangeably, and they are not. So another claim, pretty common anti-aging claim is skin texture. There are two ways that you can look at skin texture. When we're looking at skin texture, we're really looking at like the smoothness, the roughness of the skin. There are two ways that you can look at it. You can look at it from a two-dimensional standpoint, which is what the VisioScan does. It has a camera. It takes an image of the skin. And then there's software that looks at the pixels and how well the smoothness or the roughness has increased or decreased with product application. And then there's 3D analysis, which is the PRIMOS. And as you can see, it's a really great tool in looking at surface topography to see if, a specific product is actually improving that smoothness and that texture over time. We then have the skin density claims. So because we are operating in the cosmetic and personal care world, there are multiple claims that we cannot make. And one of them would be collagen synthesis. So there are products or cosmetics where people want to make claims that, it's synthesizing collagen, and making the skin more dense. And because we can't talk about collagen, because that throws us into the drug world, and the FDA does not love that, the way we get around that is by talking about skin density. So we measure the thickness of the dermis using an ultrasound, and the software is actually able to measure the thickness of the dermis. So if there is in fact some collagen synthesis, you will see that dermis thickening. The next claim that is pretty common, my throat is pretty dry, I'm just going to take a quick drink, is sebum output. So this is a pretty common claim for acne, or for products that are controlling sebum, like there's makeup, for example, or primers that control oil control, or for these oil control claims. And the way that we measure it is there are multiple instruments. The difference between the Visioscan and the Sebumeter is simply that the Visioscan has an image, whereas the Sebumeter is just a measurement. And essentially, what we're looking at are it's a little foil. And if you've ever seen blotting papers, have used it, it's very similar to that. When you place it against the skin, it kind of sucks up the oil from the surface of the skin. And so what the instrument is doing is really just essentially measuring how much oil was on the surface of that foil initially, and then after product use, what happens after, if that sebum decreases. And it's important to note that there is sebum control, and then there's sebum reduction. So sebum control is really that you start at point A and you continue to be at point A throughout the course of the study, whereas sebum reduction is really you start at point A and you decrease below point A. And that's essentially what we're measuring. So it's important to, when you're trying to make these claims, to really understand what is it that your product is doing. I don't know what's going on in my throat. The next thing that we can measure is the pH. So there are some products that claim that they don't alter the pH, so we have the capability of measuring that. And then with the glossimeter, we also have the capability of measuring skin shine. So this is a pretty good, this is a way to, if you have products that you are claiming are decreasing the shine on the skin, decreasing the gloss, this is how we would measure it. And it also can be used for hair, to look at whether a product is increasing the glossiness of the hair. We then have the skin color. So there are multiple claims you can use using the chromometer. So the chromometer can measure it can measure black and white, it can measure the green and the red hues. So this is a good instrument to use if you're trying to make redness reduction claims. So the product, perhaps people who have the skin redness, obviously we wouldn't talk about rosacea because that is a medical claim. But if you're trying to make redness reduction claims, this is a good instrument to use. Also for tanning studies, or where you're self-tanners, where you're trying to prove that the product is actually tanning the skin over a specific amount of time, or even brightness claims, where you're trying, you have a product that perhaps has an ingredient that's supposed to lighten the skin over time. We don't talk about lightening because that is a regulated claim, hence why we use the word brightening. But this is the instrument that we would use. And then also we use this instrument to measure wear of makeup. So if you have a foundation and you are trying to make claims that it lasts on the skin for maybe 8 or 12 hours, we would use this instrument to really identify whether the product is staying on or not. We do this for multiple makeup studies, whether it's a mascara or a foundation or a primer or a blush or whatever it might be. We talked a little bit about the Primos when we talked about skin texture, but the Primos also helps you identify fine lines and wrinkles. In its 3D analysis, there's some other two-dimensional analysis that I'll talk about. But if you want to make depth claims, this is the way to go. Do you want to make like a wrinkle improvement in depth or fine lines improvement in depth, that you would have to do like a 3D analysis? The 2D analysis really only analyzes the number of wrinkles in the surface area. It obviously doesn't have the capability of looking at the depth of a fine line or a wrinkle. There are multiple imaging systems. The great thing about imaging systems is that they standardize photography. So there are chin rests or forehead prongs. There are some systems that only have ear prongs that I'll talk about in the next slide. But the great thing about these imaging systems is the fact that the positioning is standardized, the lighting is standardized, and when you go from one interval to another, the positioning is further standardized because you can pull up the ghost image of the baseline and adjust the subject. If they come in at week 4, you can adjust the face of the subject to fit the baseline so that you have that reproducibility from one interval to another, which is extremely important when you're doing grading from images and also when you're doing software analysis from these images. So this is just an example of some of the images of the Campfield Vision. As you can see, there's a forehead prong and there's a chin prong, and there are multiple, there are about 5 lighting modalities. UV, so you can look at like photo damage and analyze photo damage. I mean, it's just what we call the invisible spots, so you can only see it in UV. You can't see it in regular light. The next imaging system is the color face. And I particularly love this instrument because this imaging system, because of the fact that you don't have the forehead and chin prongs and the chin rest. And as you can see, it's just 2 prongs that go into the ear. And the great thing about this instrument is that instead of having to move the position of the subject, if you want to take lateral views, the camera actually rotates around the subject. So it even further increases the reproducibility of the image from not only the frontal views, but also the lateral views. And the great thing about this instrument, this imaging system, is that you actually have real-time access to the images. So you, as a client, would have, if I took the image right now, you would have access to it right now, as opposed to waiting until after the study ends. And this is just an example of what the image looks like, and it also has multiple lighting modalities. So when we take the images, there are multiple software programs available that allow you to do specific type of analysis. And if you've been in this industry long enough, you've probably seen a lot of these marketing images where you may see an image that has like a bunch of lines on it, green, yellow, red lines. And so there are multiple things that we can analyze from the images, whether it's through images taken using the Campfield Vision CR, whether it's through the color face. So we can, all of this is obviously two-dimensional analysis, but we can look at fine lines and wrinkles, we can look at hyperpigmentation, we can analyze photo damage, which is the invisible spots that you see in UV lighting, pores, redness, skin brightness, and pore fringe, which is loosely associated with acne. So these are a number of things that we can analyze. We can also analyze these things from just photo grading, but if someone were more leaning towards software analysis, the Primos the Vistro software package or the ColorFace software package can definitely analyze the images for these attributes. And it's a reproducible analysis, because what we do is we draw a mask on a specific area, similar to what you're seeing in this image, and then this mask area does not change from one interval to another, and it kind of and then it goes, and then you take the specific mask that you just created and and it's used on all of the intervals. So you're analyzing the exact same interval each and every single time, and also the surface area that's being analyzed is also consistent. So this is one of the great things of these software programs, is there's also that reproducibility in the actual data that's being collected from the analysis. And these are just some examples of the software packages analysis. So as you can see, this person these areas are being analyzed for fine lines and wrinkles. The different colors represent the different type of wrinkle. It's defined by how wide it is. And so you can do analysis on the type of wrinkles and fine lines, or you can just do an analysis on the overall. And then, as I said, this is just, you do this for every interval, and then, do the analysis from baseline to see if there's an improvement. These images represent analysis for hyperpigmentation. So the software identifies every time it sees a hyperpigmentation spot, it kind of circles it. And for the one on the right under UV, that's for the photo damage. We can also physically measure and track specific hyperpigmentation spots. So if it's a spot treatment and you're really looking to identify a change in one or two spots, the software program allows us to be able to go in and not only look at the size of the age spot, but we can also look at the intensity and the darkness of it and whether that resolves over time. And here are just a couple examples of the one on the left is analysis of pores. So we identify a specific area where you prominently see most pores. And then from one interval to another, we can look at whether the pores are reducing in size. And then for the image on the right, these are the porphyrins, which are loosely associated with acne. But you can also analyze that from one interval to another if you have, a product that perhaps has benzoyl peroxide or trying to make claims where you're improving acne. And then because these photo booth systems are only appropriate for facial photography, there's always digital photography for areas of the body where you can't use those booths. And these are just a few examples of different types of study, whether it's a cellulite or you're looking at a neck product or you're looking at the heels. There are, unless for hair growth studies, hair growth is a regulated claim by the FDA. You have to be following the FDA monograph, and I believe the only approved ingredient is minoxidil. And there are lots of products that are emerging and have emerged where they are targeting hair growth, but because these products may not be following the monograph, the way you get around that is by talking about the appearance of hair volume. So that's for the hair claims. And then makeup evaluation. So there are a number of claims that can be analyzed, whether it's long wear. So how long is the makeup staying on? Transfer proof. So I'm sure for most women who have been in changing rooms, you might pick out a shirt and find someone's concealer and foundation all over it. So the transfer proof claim is really a claim to identify whether the product is actually transferring to clothing or material. Smudge proof claims, whether the product is smudging. We can also analyze water resistance claims. We can look at mascara to see if it's increasing the volume and the length and the curl. Mattifying claims. And the new claim that has emerged that is now a hot topic is a mask proof claim. So if you wear your mask, your makeup is not coming off. So this is our new 2020 claim that we're coming across. And then there are the most basic types of studies. If you're not really interested in the quantitative stuff that we just talked about, and you're more interested in just consumer perception and opinion, these studies are really straightforward. They're the most basic and probably the cheapest type of test that you can perform. You give people a product to use, they fill out a survey, and I would probably say these tend to be the strongest claims. So when you look at marketing claims and 95% of people loved the product, or 95% of the people thought their fine lines and wrinkles improved, 99% of the time that is coming, those type of really strong claims are coming from the consumer perception portion and not from an actual measurement. It is not common to see a 99% improvement or even a 70% improvement in fine lines and wrinkles from a topical, from an actual measurement. But is that something that you can probably decipher from a opinion or a survey? Absolutely. And then there are focus groups, which are really just geared towards learning more about the product. And there's usually a moderator who has a list of questions and moderates conversations and understands the climate, and it is usually a really good tool to use in trying to identify market needs and how, especially in the initial development of the test product. And finally, we have our acne studies. Those studies usually from testing labs such as ourselves really are more like the phase 1 trials where we recruit individuals who have mild to moderate acne and give them a product to use. You obviously have to be following the acne monograph in order to be able to make those claims. Can also look at acne scarring. And then there are the comedone studies where it's really, you're not looking at acne lesions, you're just looking at overall comedones. So people don't necessarily have to have breakouts, they just have to have acne prone skin. And what we're identifying is to make these non-comedogenic claims, are we seeing the same number of open and closed comedones, not necessarily decrease, we just don't want those comedones to increase. And there are two ways to go about looking at making these non-comedogenic claims. One would be the face studies where, you just give people the product to use, they use it on their face, and you count comedones before and after the study. And then there are the follicular biopsy studies where the product is placed under a patch and is patched on the skin for 4 weeks. And then at the end of the study, you take a glass slide, you put some glue on it, and you place it on the test site where it was patched. And essentially what you're doing is you're looking at the slide under a microscope to see if the follicular bulbs are clogged. And this is, you can test multiple products. So lots of people like to use this methodology because it's just a bigger bang for your buck. But there are products that are not appropriate for follicular biopsy, and these are products that have known irritants in them, because if you place a known irritant under a patch, you will end up getting a false positive, because the natural reaction of the body is to produce comedones when there is a irritation reaction occurring on the surface of the skin. So that's just a good thing to keep in mind when trying to do these non-comedogenic studies and trying to identify which method is the best method for use for your particular product. And with that, that is basically clinical testing in a nutshell. I'm going to apologize for the throat issues that I was having. I'm not really sure. I probably just don't talk that much anymore. But I appreciate everyone's time, and I hope that I have left you with some valuable knowledge on safety and efficacy testing. And I am open for questions.
Yes, thank you, Rania. We will go ahead and open it up for questions now. Please write out your questions in the chat section at the bottom right. I will go ahead and give everyone a few moments to type in their questions. We've already actually received some throughout the presentation, so I'm just going to go ahead and start asking those.
Mm-hmm.
So the first question, it says, is dermal safety required by regulation for new cosmetics and OTC?
So cosmetics are not regulated by the FDA, and I'm only going to speak to the United States, the US, or North America. So cosmetics aren't regulated by the FDA. So there isn't a particular test that you have to perform. It's really just due diligence. And it's recommended. And as far as OTC safety testing is definitely required.
And we have another question from him as well. He asks, do these dermal and ocular tests regarded cruelty-free and no animal test?
Yeah, we have it. I mean, we haven't been doing animal testing in the United States or Europe for decades. So everything is on people, humans, even the in vitro tests are on membrane substrates. The head cam is on a hen's egg. PETA identifies this as not an animal test. But if you really want to veer on the side of caution, there are other tests such as the OptiSafe, which are it's just a membrane.
Thank you. He has another question too. He asks, is there industry standard to evaluate dermal claims such as anti-wrinkle and moisturizing? And do these dermal performance tests you are introducing following the industry standard?
So to answer your first question, there are no specific regulations because, again, cosmetics are not regulated. However, the tests that I described are totally standard, industry standard tests. There aren't that many instruments out there. These instruments have probably been used since Kligman's time, so for decades right now. There are multiple publications on them. So they're definitely the industry standard, but no, there is no, they're not regulated.
We have another question from Adrienne. She asks, what ingredients can be used to get the eczema seal on our package?
I'm sorry?
She asked, what ingredients can be used to get the eczema seal on our package? So on their product, maybe.
So eczema is a monographed, there's an FDA monograph. So it's a regulated claim because you're treating a condition. And there is an FDA monograph that lists, and I don't know all of the ingredients off the top of my head. I know there's a certain percentage of colloidal oatmeal that you can use, but there are, in the FDA monograph, you would find a list of the approved ingredients and the percentages that you have to fall within to be able to make eczema claims. And as far as the national seal for eczema, it's like a seal of approval. There are a plethora of tests that you have to perform in order for them to allow you to make this claim. And it's actually, and there's money involved. It's actually quite expensive. But if you are interested, I you can email me and I can send you a guideline of some of the testing that they require in order to be able to have that seal. But initially you need to be following the monograph in order to fall under the capability to make eczema claims.
She had another question as well. She asked, do you find clients are doing more clinical testing and more panel testing? Do consumers put more faith in panelist comments or instrumentation?
That's an interesting question. So if I'm to be very frank, and anyone who knows me knows I'm extremely frank, it really comes down to dollars. I would say the really large companies and the medium-sized companies as well really rely on both, quantitative as well as consumer. Perhaps if you're just, a new brand and maybe you don't have the kind of funds to support the quantitative, you can start off with consumer. But I think in today's day and age, the consumer just requires more information. And so I think it's probably a good idea to have both. But ultimately, it's going to come down to cost and where you plan on marketing. So, if you're going to QVC or if you're going to HSN, or you're going to have Sephora, you're going to Walmart, they all have their own requirements that you have to fulfill.
She asks, what is the difference between control and reduce sebum?
So control sebum is that it's not changing. That let's say I took a measurement at baseline and my sebum was a count of 30. I'm just going to use a number, right? Like that's not the unit, but the number is 30. And then I apply the product and I take another measurement 8 hours later and the number stays close to 30. That's control. That it's not increasing and it's not decreasing. It's just kind of staying the same. Reducing sebum is I start at 30, I apply the product, I take a measurement however long or much later, and that number goes from 30 to 15. And that's what reduction is.
We have a question from Sheila. She asks, when conducting skin barrier TEWL studies for rinse-off formulas to support non-drying and non-stripping claims, how long, single or multiple days, and or how many product applications are generally typical to support the claim?
So for rinse-offs, it's a one-time application for these studies, and you really want for rinse-off products, it's a fairly immediate interval. So 5 minutes, 10 minutes, 15 minutes, 30 minutes, you really don't want to go past that because the reality is rinse-offs, the hydrating or the non-drying properties don't really last that long. Perhaps there are some out there that do, but my experience is that these usually tend to be very short-term intervals. And it's just a one-time application, and it's usually, it is always compared to a control test site where you have the test product site where it's the the cleanser, and then it's removed by very controlled removal by water, and then your control site is just a test site with no test product, but you're still applying water because water has a drying effect, and then you compare those two to each other. And you hope that your test product is better than the control product.
Roselle, she asks, what is the minimum number of subjects that what can be acceptable to test? And do you have a standard number of subjects that you test, for example, for safety in use studies?
Kelly, what was the first part of the question? Wait, so how many product applications do you support the claim? And then what was the second part? Do you have a standard number?
Yeah, what is the minimum number of subjects that would be acceptable to test? And do you have a standard number of subjects that you test? And it says example for safety in use studies.
Yeah, so it varies from one study to another. So usually for hydration studies, overall, you don't want to test on less than 25 to 30 people for statistical reasons. The less people you have, the weaker your statistics. So the more difficult it is to have statistically relevant data. If you have less than 25 subjects, then the data that we're collecting is usually helping you identify trends, but not necessarily will give you information on whether something is statistically better or not. Typical hydration skin tool studies tend to be 25 subjects. Safety and use, we usually recommend at least 30. I have, lots of clients who test on 30, and then I have lots of clients that test on 50 because they have more visibility in the market, so they just want a larger sample size. But I would say I would definitely not go below 30 for safety studies. And hydration tool, 25 is average.
Time of the safety or performance test, and can you have a few examples?
Okay, so the lead time of the safety, so for a study that requires 25 to 30 people, you're looking at about 4 weeks to recruit. And then you have the study duration, which whether it's 2 week or 4 week, and then you have the reporting time, which can be anywhere from 2 to 4 weeks. As far as examples, I'm not really understanding a few examples of what? I'm not sure examples.
Yeah, if you have a few examples. Dong, if you wanted to reach out to Rania and ask any specific questions, feel free to do that if you wanted to follow up with that. I don't see any additional questions come this time. I do want to let everyone know that this webinar presentation has been recorded. All the participants today will receive a follow-up email once this recording is available to view. We also post our webinars on our ALS Global website and our ALS YouTube channel in the webinar playlist. If there's not any more questions I don't see, I want to just thank you for attending today, and also for Rania for presenting. And I hope everyone can enjoy the rest of their week. Thank you.
Thanks, you too.